Hello everyone, my name is Khyati Singh and my mentor for this project was Jiang. So my topic is a machine learning question framework that I will be proposing, and it's essentially about mitigating bias in clinical note-taking. So the reason that I chose this topic was after attending a natural language processing lecture at a state university. I thought the topic was really interesting, and seeing how, words and affect bias and how AI and machine learning can be used to solve and help that. And so I wanted to do something like that related to healthcare. So that's why I chose this topic, and I am presenting from Texas. Let's get right into the presentation. So as you can see, we're going to be going over a research overview. This is essentially about most of the things that I will be presenting, including the abstract, the intro, instances of bias, current metric models, along with the actual proposal, a post-processing, like the effects of the model, seeing the Mimic3 dataset and looking at negative descriptor findings, and finally the conclusion and key takeaways. So first, the abstract. So in the abstract, we go over how ethnic and gender bias has the capability to creep into medical notes by doctors and physicians, and this can end up negatively affecting the kind of healthcare and treatment they are receiving if they're having a bad view of their patient, which is going to, damage their relationship between the patient and physician. So in this study, we're going to be doing a literature review. We're going to be looking at existing metrics along with proposing our own framework. We're going to be looking at the relevance in the context of the Mimic3 dataset. And of course, we're going to be concluding with different key findings and questions for the guideline of, hopefully the framework. So intro, let's define what exactly is bias and fairness. So bias is defined as a prejudice in favor of or against a person, thing, or group, and in machine learning is a systematic error due to, systematically prejudiced results. And fairness is the ethical concept of treating people right from all demographics, and in machine learning plays a process of correcting algorithmic bias in order to, make things equal for everyone, essentially. So these are two very important words to, define and know about within this, research. So getting further into the intro, we see that a lack of health equity has become a silent killer in healthcare that has only begun to be recognized in the machine learning world. So a computer program combed through over 18,500 patient notes, and it showed that Black patients were 2.5 times more likely to have negative patient descriptors within one study. We see that the use of AI and machine learning has promised to improve fairness within healthcare. However, these new developments can also have negative implications if AI processes are not reliant or data is not of enough variety. And so the drawback is that AI also has the potential to exacerbate existing health inequalities instead of help aid them. So we can go into seeing common instances of bias, which the most common is ethnic, gender, and socioeconomic. Ethnic can be for minority groups such as Hispanic and Latino groups and African Americans. Gender is often women, such as 1 in 5 women saying that they have felt ignored or dismissed by their healthcare provider. And socioeconomic is things like Medicaid, Medicare versus someone is single or unmarried, and things of that sort. So in the paper, we look at existing machine learning framework metrics and explore those models. So the IBM AI Fairness 360 model has ways that they have pre-processing, in-processing, and post-processing that they define machine learning models, and states that pre-processing is the best because you can interfere with the data collection process, which is how we created our question framework. The COVID-19 model introduces a standard level of metrics in healthcare, and regular model metrics provides a guideline of the kind of things that you want to be aware of within a machine learning model. So here we can see a technical framework of the pre-processing demo of using this thought framework. Essentially how the thought framework works is that we want to create a machine learning model that has a guideline, a set of questions that the physician can check with in order for them to be more aware of their bias, so that in turn, the electronic health records have less negative descriptions. So we see different questions about, if physicians are aware of their bias or how the interaction is going. And so the, expected hopeful outcome of this is that the patient and physician interaction is going to end up better because the physician is more aware of their bias, and that electronic health records will have less negative descriptors due to, the physician really thinking about, are these descriptors needed or not? So we can see this in a post-processing setting of clinical notes that have already been written. So when we're evaluating verbiage of physician notes that have already been written, we can identify certain negative descriptors and see, are these words really necessary or not? And if the clinician truly kept in fairness when we do a comparison of certain demographics. So as we go further, we can see a real-life data set. The Mimic3 data set is from the medical center within Boston, where we are looking at real negative descriptors within a certain sampling. So when we sampled the first 1 million rows of data, we can look at the frequency of some of the most common negative descriptors that we have identified. So looking at this, I see the different percentages of refused compared to uncooperative, compared to non-compliant and rude, etc. Now, this shows that these negative descriptors are frequent. We see them in notes. But what we're really looking at is there bias or not when you compare certain demographics? So we see this comparison looking at demographics of women and men. So when we're looking at the rates of how many negative descriptors are showing up for women versus men, we see more for women. So we're using the same 1 million sampling, and we were essentially looking for the same 4 to 5 negative words, and we saw more show up for women than men. Now, it's important to acknowledge that this was a smaller sized sampling, and we were not looking at the infinite numbers of negative descriptors, but rather the few that we decided to identify. But when we compared the usage, we saw a significant increase of women compared to men, being used within our Python program. And we were identifying them fairly with the same words, the same ways to look at gender to make sure that we were being fair in everything, and this was the percent comparison that we found. And so this can essentially portray the idea that female patients seem harder to deal with as a result of physician bias rather than their actual action. So the conclusion of this is that these and countless other negative key descriptors impact the way that we see electronic health records. So it's important to, have a framework, have our, the machine learning metrics and framework that we provided for different questions within the paper. And we did this by, of course, examining existing solutions of bias within healthcare to create our own innovative framework of how to help foster more unbiased healthcare. And this is really important for everybody to have fair and equal treatment. So I'd like to just say thank you so much for listening. It really means a lot that you've made it this far and that hopefully you were invested in the presentation. It was very fun making it. It was very fun doing the research, and hopefully you maybe learned a little bit of how we can use AI and ML to help the world. These were some of the sources that I used. If you're a little more interested in reading into more papers, you're more than welcome to look at some of these articles and different research papers. And if you'd like to, you can always contact me for future research. This is my email address and my LinkedIn. I'm more than happy to answer different questions or, be contacted for research. It was really fun to be able to do this and present. Thank you so much.